where was I? Okay, so my upcoming surgery. Okay, so I'm scared and excited all at the same time, and I'm trying to focus on the positive of the surgery because of all of the negatives of the surgery. Let's see. So yeah, I battle pain daily. And it's so frustrating because, seriously, if I'm not in pain, then I'm so medicated that literally I don't want to get out of bed. I don't want to do anything. I feel like poo. Or if that's not happening, if the pain's not happening and the high meds isn't happening, then I'm having stomach issues and I'm having bloated and I'm in the bathroom and I just have horrible pains of tummy problems. So it's like a full circle of stupidness that just, it dictates what I do in my everyday life. And it's frustrating. And I'm tired. I'm drained. I'm so tired of trying to live my life. And I mean, I got the weight loss surgery for my kids. For me, of course, number one, but for my kids, because I wanted to be able to have a life. I wanted to be able to do things with my kids and be there for my kids. And I feel like the stupid pain and these stupid meds have taken that away from me. And it's so frustrating to be able to be in this body and be able to do things and physically not be able to do things. It's so frustrating. So I am praying. There is a fly in this truck. Did you all see that? Oh, it's still on me. Ah! Hold on. OMG. Did you all see? It's like it flew and died. Oh my gosh. I don't even know where. What the? I don't even know. I don't know if I can finish this video now. Okay. I don't know where it went. Okay, flies are no big deal, but when they come out of nowhere and then I saw it in the camera. Where were we? I honestly, I have no idea what I was talking about. Honestly, I have no idea. I have been struggling with endometriosis for quite a long time. Right after my third child was born, I actually had a hysterectomy. Well, I went in to have a full hysterectomy. And after surgery, when I woke up, my doctor said, "Oh, I left your ovaries because they looked nice and pink." And being as though I was 29 years old, she didn't want to put me straight into menopause, even though I had already done the research. I was full aware of what was going on. I signed the paperwork saying I was having a full hysterectomy. I knew what I was getting into. I knew what the trade-off was, or I knew what the trade-off could be. The percentage of women who have a hysterectomy, a full hysterectomy, having endometriosis is a pretty good chance of, that pain going away. But I didn't get that opportunity. My doctor made the choice to leave my ovaries, and ovaries are the number one issue with endometriosis because they are the ones that produce the hormone that causes the pain. But anyways, not getting into so much detail on that. But, so, I've been to specialists. I've been to pain management doctors. I got away from pain management doctors because I was sick and tired of being a number. I was sick and tired of every single month having to go into this stupid doctor's office. They won't just refill your pain meds. You have to actually make an appointment, see them. They look at you like they've never seen you before, even though they've been treating you for a year, give you your high doses of pain meds, and then you're done. And every single month when I was like, I want to lower my pain meds, I want to try something different, can we do this, can we do that, there was always something. Whether that month I ended up not even seeing the doctor and I just saw the nurse practitioner, so I couldn't ask her, or even if I did ask her, you know, she's like, I'll talk to the doctor, and then that never happened. Or I don't like pain management doctors, just because of my situation, just because of my situation. I know they help lots and lots of people, but in my situation, no. So then I got out of the pain management doctors, but still going to my regular doctor, I'm still on just as much pain meds. They've flip-flopped, they've increased, they've decreased. I've done anything and everything to get off this damn pain meds. A couple years ago, I went to another doctor who said that, yes, he can take my ovaries out. Thank the Lord. So I went in for surgery, came out. Not only did he not find my ovaries, he flat out, I couldn't find them, but 14 days later, I was rushed to the emergency room with a perforated bowel. So that's all I got out of that surgery. So with the perforated bowel, they ended up having to cut me this way, which was devastating. You know, after finally, you know, shrinking down to the size I am and having, you know, a decent stomach, they sliced it. But it is what it is. Well, after that surgery, I ended up having a severe infection. So they had to open up 2 different spots of that incision. And I, you know, had to do the whole packing thing, and they had a home nurse coming to my house. And, you know, then after that, then I had to do it on my own. Well, then now those scars have they healed all weird, and my stomach folds in on itself. And so if I don't keep it all dry and I don't, it's just gross. It's gross. And it's like, it's weird. You know, I have more hanging on this side than I do this side. And, you know, I have hanging, you know, from the weight loss surgery. You know, it's not huge, but I've got it, and it sucks. After having a failed surgery of trying to find my ovaries, and 14 days later going back in for an emergency perforated bowel, less than a month later, I had to go in for emergency gallbladder surgery. So I ended up having 3 surgeries within 3 months of each other. Yeah, that sucked. So, when I went to a specialist last year, he said, no way, Jose. Basically, I am considered a hostile abdomen. And basically with the endometriosis, it has attached, you know, everything to everything. My bowel to my abdomen wall to everything. Everything is attached to itself with scar tissue, with endometrioma. I'm just a hot mess inside. Well, anyways, that leads to this doctor. I got referred to this doctor. It was basically a last, you know, this is the doctor that will do surgery on the people who are deemed nobody will do surgery on them anymore. I did my research this time. I am hoping it pays off. I am praying it pays off, because I have done so much research. I have called several different states, several different doctors asking about this doctor, reading reviews, and I even talked to my doctor, and I cannot find one negative thing about this doctor. So he's going to attempt to find my ovaries and remove them. He is also, gosh, it's amazing how doctors have the handwriting from hell. I tell you what, even though I know what I'm going in for, like, I'm trying to read it, and so that's being done, hopefully. There's something else I'm missing. You know, obviously clean up any endometriosis they find. What else am I missing besides what else I want to say? And this is what makes me smile right here. This part of the surgery. Scar revision. Scar revision. I'm not sure how many of you guys know what that means. But that means that my tummy, is going to be gone. that right there is just like, oh, yeah, I'm really happy about that. This is like the happiest I have acted, okay? This is seriously is the happiest I've acted, because I'm just still like in shock that is it really happening? I mean, I keep wanting to call and make sure, you know, that, you know, the insurance, everything is okay. And, you know, like, are you sure? Even when I had my pre-op appointment last week, I'm like, okay, so is this going to be part of it? And it's actually written on my paper. It says scar revision. You know, I mean, I wish it said something else that just made it so clear to me. But it is what it is, and I'm not going to complain about, you know, a title of what that means. But, you know, they explained to me that I'd be going home with drains and, you know, some of the follow-up care and stuff like that. And I have to say, thank you so much, Connie, for sharing your story, because I have been glued to my YouTube when it came to your surgery that you just had not too long ago, because knowing that I was going to have surgery and praying that I was going to have something similar, I just really been watching you and just, you know, following along and stuff like that. And so thank you so much for sharing that, because it is a huge help, So I kind of, you know, know what to look forward to, or you know what I'm saying, when it comes to the aftercare and stuff like that.